Hello for one last time. Let's talk about birth control, preventing pregnancy. Lots of different methods, and we'll hit some of the highlights of these different types of birth control. So they include everything from abstinence. Of course, that's where you don't engage in sexual activity, and that's 100% effective. There are natural methods that are used depending on a couple's beliefs about contraception. Hormonal methods that involve estrogen and progesterone or synthetic man-made versions of those in various combinations. Emergency contraception. Barrier methods like the use of condoms, for example. IUDs, these are devices that are actually implanted inside the uterus and make the endometrium unfriendly for implantation of a developing embryo, and permanent sterilization that can occur as well. This is a diagram which kind of gives you, in a broad sense, an overview of these different types of birth control methods, from the least effective down here at the bottom to the most effective up here at the top. So the most effective methods include things like female or male sterilization, obviously. Implants, things like Norplant, where these little strips that contain hormones that are gradually released over a number of years, and those are extremely effective. An IUD is a device that's actually inserted into the uterus of a female and makes the endometrium there unfriendly for attachment of an embryo. And as you keep moving on down, here in this sort of middle tier, these are various hormonal methods for birth control, except for this one. Breastfeeding for about the first 6 months or so after pregnancy actually inhibits ovulation and inhibits the ovarian cycle, and so that will prevent a pregnancy as well. Good old birth control pills, and they're effective, and they're not quite as effective as these other methods you see up here at the top. And moving on down the list, less effective things like use of condoms and diaphragms, fertility awareness methods where you're plotting out, the female plots out her monthly cycle and figures out around the time at which ovulation is occurring. Because remember, if you know about when ovulation is occurring, you've just got a short window of time right after that during which conception can occur. So if you have regular monthly cycles, you can calendar things and figure out when you would be the most likely to get pregnant, if that's the method of birth control you want to use. The withdrawal method, where the male withdraws just before ejaculation, not very effective. And if you just use spermicides are chemicals that kill sperm cells, but if those are used by themselves, they're not all that effective either. And in fact, less effective down here means about 30 pregnancies per 100 women who are sexually active per year. So if the withdrawal method is your method of choice for birth control, that's not very effective. Each year you have about a 1 in 3 shot of getting pregnant if that's your method of birth control. So things like the withdrawal method, where the male withdraws from the female before ejaculating, the rhythm method, where you're actually charting out your monthly cycles, figuring out that 2-week period, 14 days after the beginning of your last menstrual period is around when ovulation should take place. So right around that time, you don't want sperm cells to be deposited in the female for a couple of days before that and a few days afterwards, because that's the time period when conception can actually take place. Now, in some women, the natural, that's sometimes called natural family planning. If you do have regular menstrual cycles, then that method can work pretty well. It can actually be fairly effective. All right, hormonal methods, these are more effective methods of birth control than any of the natural methods. And the withdrawal method is not effective, so don't use that as your only form of birth control. But hormonal methods include oral contraceptives, so those are your birth control pills, or BCPs. Patches that are placed on the skin, ortho-evra patch. Nuva ring, that's actually inserted into the vagina. It's a little ring that releases hormones gradually. injections, Depo-Provera shots, where a hormone-containing solution is injected under the skin, and it gradually releases hormones over a period of time. And then implants like Norplant, these are actually like little plastic sticks that are inserted under the skin and will release functional hormones that can inhibit pregnancy for several years. All right, so what are these hormonal methods? They contain estrogen and or progesterone. So there are different hormonal methods of birth control that are used. Most of them have a combination of these two, estrogen and progesterone. There are some types that only contain progesterone, and if a woman is going to go back on birth control right after childbirth, sometimes she'll just use a hormonal method that only contains progesterone because she's less likely to develop blood clots, which can be sometimes an issue after pregnancy. How do these work? Well, they work through negative feedback. Remember, estrogen and progesterone have strong negative feedback for the secretion of FSH and LH from the anterior pituitary. And if you're not secreting FSH and LH, guess what? You're not going to ovulate. And also, the uterine lining does not develop in a proper way to sustain a pregnancy. So even if you did have an ovulation event occur while using these hormonal methods of birth control, the uterine lining is not suitable generally for implantation of an embryo. And that might sound counterintuitive based on what we've just been talking about, because we've been learning about how estrogen and progesterone are needed in order to sustain a pregnancy. But if you go back and look at the hormonal changes that occur, estrogen levels rise first during the follicular phase of the ovarian cycle, that first half, and that stimulates the thickening and the thickening of the endometrial lining, the development of the glands, and so forth. In the second half, after ovulation, then you have the effects of progesterone really taken over, and that's where the glands mature and secrete the nourishing fluids for the embryo, and you really establish that good blood flow into the endometrium. So yes, you need both of those hormones, but apparently you need the estrogen first and the progesterone later to develop the endometrial lining properly. If you're giving both of them at the same time, that endometrial lining actually stays pretty thin and does not develop properly. Another thing that happens, if you remember, one of the things that progesterone does is it stimulates the cervical mucus to become thicker, and so it forms a plug over the external os, the opening into the cervix, and so the poor little sperm cells can't swim past that and make their way through the cervix into the uterus and up the fallopian tubes to find an egg that may be there. So all of these things are going against a pregnancy developing. So if you use these correctly, you're about 99% effective. So you only have about a 1 in 100 shot at getting pregnant if you're using these correctly. This is important, though. There's no protection from sexually transmitted diseases. So you hear about how things like condoms can protect you from sexually transmitted diseases, and yes, that is true, because that's actually a barrier between the penis and the vagina. These hormonal methods of birth control are not protecting you from sexually transmitted diseases. There are a number of different types of birth control pills. Birth control pills are taken daily, and they're designed to create a 28-day cycle. And you'll hear about birth control pills that are, I think the monophasic and the triphasic types are the most common. There are also biphasic types. Monophasic means one phase. So that means, now what you do when you take birth control pills is, and here I am telling a class that's usually going to be majority females, many of whom have probably taken birth controls, what they're doing. But you take 21 active pills per 28-day cycle, and those contain hormones. And then you take 7 days of fake pills that don't contain the hormones. And the reason why you take those fake pills for 7 days is so that the uterine lining can be shed and you can go through a menstrual period. During the other 21 days, if all 21 of those pills have the same level of hormones, those are called monophasic. There's one phase. Biphasic means that the estrogen and progesterone levels are divided up into two uh, two sets of concentrations. Triphasic means there are three. So for 7 days you've got a certain level of estrogen and progesterone. The next 7 days you have another, and then the third 7 days you have another. And then that fourth set of 7 days you're not going to have any of the hormones, and that's the time during which you should have your menstrual period. The reason those biphasic and triphasic pills were developed, the original types of birth control pills had fairly high levels of hormones, and there were a lot of side effects associated with those. And so as more research and studies were done, those levels were dropped. And back during the 1980s, the biphasic and triphasic pills were developed to try to mimic more the natural fluctuations in these hormone levels that occur throughout an ovarian cycle. The idea there was that would hopefully help reduce side effects even more while still being effective. So all of these three types are highly effective. It's just differences in the doses of those hormones throughout the 28-day cycle. Then there are some newer types of pills on the market, extended cycle or continuous use birth control pills. So things like Seasonal, where you take 81 days instead of 21 days of active pills with hormones, 7 days of inactive that allow for a menstrual period once every 3 months. Then Seasonique has 84 days of active pills with 7 days of low-dose estrogen pills, and that's supposed to allow for about 4 menstrual periods per year. And then there's a type called Librel, where you simply constantly take active pills, and that's 365 days a year and supposed to completely eliminate menstrual periods. So lots of different options on these hormonal methods of birth control pills. Ortho Evra is the patch, and so this is a contraceptive patch that's applied to the skin. It contains estrogen and progesterone, so it's being delivered through the skin rather than in a pill form. You apply this patch weekly. You have to change it out each week. And you do that for 3 weeks. And then for the 4th week, you don't wear the patch. That allows you to go through your menstrual period since you won't be exposed to the estrogen and progesterone. So that's mimicking what happens naturally during the ovarian cycle. The corpus luteum dies, estrogen and progesterone levels drop, and that leads to the sloughing off of the endometrial lining in the uterus. A side effect of the patch may be that it could cause some skin irritation. NuvaRing is a ring that is actually inserted into the vagina, and this ring contains estrogen and progesterone that are gradually released for 3 weeks. And you take it out after 3 weeks, you leave it out for 1 week, and you go through your menstrual period, and then you put a new ring in to start over for the next monthly cycle. Depo-Provera shots. These are birth control shots where you have a solution containing hormones that is actually injected under the skin, and this solution kind of more or less stays in place, and these estrogen and progesterone diffuse out gradually over about a 3-month period of time. And so that makes it nice. You don't have to remember to take pills every day. It's about 99.7% effective, so you have an even higher rate of effectiveness. But it will stop menstrual cycles during that 3-month period. You may have, if you're using these, you may have irregular menstrual bleeding and some spotting for about 3 to 6 months before the menstrual periods stop entirely. Implants, if you're going to get implants, you actually have to have a minor surgical procedure for these to put in. They're little plastic capsules that are about the size of matchsticks, and they're inserted under the skin and the arm, but they're highly effective, 99.95% effectiveness rate. So that shows you how well these hormonal methods of birth control can actually work. It takes about 15 minutes to put those in. So you should consider those to be a long-term birth control method if you think you're going to want to have a baby within the next couple of years or so. That's probably not the best method to choose. Here's what they look like. And they're smaller than what I'm seeing here on the screen, but here's a diagram here on on the arm of a female where they're being inserted. So you can kind of see that in comparison to the elbow over here. Can be left in place for up to 5 years. You have uh, hormones in here, progesterone, and it just gradually gets released from those Norplant capsules for several years. All right, how about emergency contraception pills, or ECPs? So these are pills containing hormones that can be taken within 72 hours of the act of unprotected intercourse, or if you've had a failure of some contraception method like a condom burst, for example, or your withdrawal method didn't work as effectively as you were hoping. So these are effective. They reduce the likelihood of pregnancy by about 75 to 84%. Things like Plan B, for example, have very high doses of progesterone. And so what that's going to do is that's going to suppress, it's going to have negative feedback on FSH and LH secretion from the anterior pituitary. So that's going to prevent ovulation if you haven't already ovulated. Now it also makes the endometrial lining of the uterus inhospitable for implantation. So if conception did occur, it makes it less likely that the little tiny early embryo is going to be able to implant along the inside lining of the uterus. And so this type of contraception generally have 2 sets of pills that have to be taken about every 12 hours. And some people find those types of methods controversial because there is a possibility that conception has occurred and you are blocking that very early embryo from attaching to the endometrial lining and just forcing it to be expelled. Barrier methods, okay, these prevent pregnancy, as the name suggests, by blocking sperm from meeting the egg. And so these include things like the use of spermicides, which are chemicals that kill sperm before they can swim their way up into the uterus in a fallopian tube. Male condoms, female condoms, diaphragms, cervical caps. Okay, so all spermicides are chemicals that kill sperm in the vagina, and there are different versions. There are jellies and foams and films and even suppositories that can be inserted into the vagina and contain spermicides. Some of these will work instantly, others require pre-insertion. So working instantly means you could use them right after sexual intercourse, although that's taking a pretty big risk if this is your only method of birth control. Only about 76% effective. So if this is your only method of birth control, you have a pretty good chance of getting pregnant every year if this is what you're doing. However, they're very good when they're used in combination with some other method like condoms, male condoms or female condoms, which sometimes have a failure rate, so if or have failures associated with them. So if you use a spermicide in combination with a condom, it reduces the chance of that failure. Diaphragms or cervical caps, as the name suggests, that's a latex barrier that a female gets fitted for by a physician, and it has to be inserted up into the vagina, and it covers the external os of the cervix, so it fits over the cervix. So it actually has to be checked to make sure it is positioned properly, and it should also be used with a spermicidal jelly to kill any sperm cells. So that's giving you a 1-2 punch there. Can be inserted up to 18 hours before intercourse and can be left in place for about 24 hours. All right, so if you insert it properly, 94% effectiveness rate, but the typical effectiveness rate, if this is your only method of birth control, is only about 80%. Intrauterine contraception, or IUDs, these are generally very good methods. They're up at the top of the list for effectiveness. And this is the most common reversible type of contraception worldwide. And one type is called Paragard, or copper T380A, And those can be left in place for 12 years. One advantage is there's no production of hormones, but you can have some increased blood loss and cramping with menstrual periods. And the copper nature here tends to act as a spermicide, and IUDs, sitting in there on the inside of the uterus, that tends to interfere with implantation of an embryo. And then there are other IUDs, and you can see this picture of this hand here, this little T-shaped device here is the IUD. And these actually secrete hormones, levonorgestrel. So not only do you have the IUD helping to block attachment of an embryo, but you also have this releasing hormones, which do things like thicken the cervical mucus, suppress the endometrium from developing properly to sustain a pregnancy, and you have the anti-ovulatory effect. So you get a 1-2 punch with an IUD that is secreting these hormones. You can have irregular spotting and bleeding. Amenorrhea, lack of menstrual periods altogether, occurs in 20% of females at 1 year, 80% of females by 5 years after insertion of one of these devices. Okay, the most effective method of birth control, other than abstinence, is permanent sterilization. So in males that's called a vasectomy. And so down in the scrotum, each vas deferens is cut and tied off. That's what ligation means. And so now the sperm cells that are developing down in the testes travel through the epididymis, start their journey up through the vas deferens, and they can't go any further because it's been cut. So they'll never make it up here to combine with the fluids from the seminal vesicles and the prostate gland to become part of the semen. And as I mentioned in an earlier lecture, yes, if you've had a vasectomy and you're a male, you're still going to produce a normal amount of semen because the vast majority of your semen volume comes from these seminal vesicles and the prostate gland, not the sperm themselves. And I also mentioned before that you're still producing sperm, they just don't make it any further than here. They die, and phagocytes like macrophages come in and gobble those poor little sperm cells up to clear them out. So no, you will not continue to produce sperm, and your testes will not get bigger and bigger and bigger until they explode if you have a vasectomy. Failure rate is about 0.1%, but that's kind of questionable. You wonder whether the vasectomy was performed properly if you have a failure rate with it. If it's reversed, then the vas deferens, these two portions of it, have to be reconnected. And so sometimes that can work and sometimes it does not. So that's something to keep in mind. If you get a vasectomy and you're a male, you need to consider that to be a permanent form of birth control. Don't count on being able to get that reversed later. Reversals are only effective in some males and not in others. In females, tubal ligation, as the name suggests, the uterine tubes, fallopian tubes get cut and tied off. So you may also hear of that as a woman getting her tubes tied. And this may eventually lead to heavier periods in females who've had this done. And the failure rate actually seems to be a little higher for this procedure than it is for the vasectomy. And think about invasiveness too. You know where the fallopian tubes, those are down in the abdominopelvic cavity of the female, and the vas deferens tubes are located in the scrotum of a male. So this is a much more invasive procedure than a vasectomy is. This is major invasive surgery. This is not. All right, so on that note, that concludes Unit 5. That concludes the online version of Biology 202. Thank you very much for listening to me through this entire course. I know the reproductive system was fairly long, so that's one of the reasons why I saved it for the final unit, because I knew the final unit would have a longer period of time during which you could work on it. But as always, please feel free to let me know if you have any questions about the content, and please bring up any topics for discussion. Hey, the reproductive system is usually the body system that generates the most conversation, so please feel free to bring up any questions you might have over on Piazza so that everybody can benefit from those. And thank you very much.